When you're sick with a viral illness and you're trying to increase your caloric intake to deal with increased metabolism, are there any specific types of calories that you should be focusing on or types of food groups?
Again, number one is going to be fluid. So we're always looking at soups. From that, you're going to looking at fats because fats are packed full of calories in a small amount. So depending on how much your stomach is able to tolerate
Hmm.
or any GI symptoms that you might be contending with, or any, say it's chewing or if you're coughing, swallowing ability might have to go to softer foods. But we always lend kind of on the soup side of things. And if you can pack them full with something like, I make cream-based soups a lot. It could be like a cream of potato soup where you're making this with a half and half because the volume at which you're taking in then is going to be packed full of nutrients. So we
I
can go
see.
down that route. But you have to maintain the hydration. So this is COVID-19. We are seeing weight loss. And again, with the symptoms that folks are dealing with, when you're talking about the fever and your metabolism is going through the roof trying to fight this thing. Your body's burning through proteins because it needs these proteins for your immune system. And so we're going to see some sarcopenia as a result of this. So you'll
Mhm.
end up with ultimately a reduced metabolic rate after a couple weeks of trying to fight this thing.
Okay. That's well taken. I think from the medical side, when we see patients come in, our first direction to them is to try and, if you can, take a medication to reduce the fever because that can help with the symptoms. And I think it can help people feel perhaps start to regain a sense of hunger or thirst. And so I recommend Tylenol if you have a fever. And then, like you're referring to liquids, liquids are important in staying hydrated. What's your take on, healthy food options when you're ordering takeout or delivery to support some of our local restaurants?
Yeah. And so you'll catch from me over and over and over again. I'm looking for produce. I'm really looking for antioxidants and colorful kinds of meals. And I'm always looking for heart healthy because diabetes and heart disease are just rampant. And so we're trying to watch the amount of fats that happen to be out there. And so when I look at ordering out, pizza can be okay. You go cheese and you load that thing up with vegetables and a thin crust. If you're gluten free, that option's available as well. Some of the simpler places might be like a Chipotle. There's beans. There's all kind of beans that you can get there, and you can get chicken and
Mhm.
vegetables. So you can order it in a healthy fashion with brown rice and vegetables and chicken, and you watch out for kind of saucy things that are going to show up. So just like you would at home or any restaurant, you want to be in the driver's seat. You want things to be simplified, kind of like fajitas versus an enchilada. An enchilada, you're out of the driver's seat, but a fajita and tacos, you're in the driver's seat. And so
Okay.
I think those are the heart healthy kind of tips that you want to go about.
Do you have any specific red flag versus green flag words when it comes to ordering, like steamed versus fried, things like that that we might not think about as often?
You nailed it. Fried, you want to watch out for. Any white sauces you want to watch out for. Steamed, at least the American population, when you say steamed, man, they make this face at me as if it's just, I'm asking them to cut their right hand off.
Mhm.
There's a flavor concern that's there. And so again, in an opportunistic time, we're eating our foods at home and we have the chance to prepare our foods at home. This is the time to go down that steamed route and try seasonings you have in home, spices, if you will. And so
Mhm.
spicy food tends to be very lean. It can be very lean without a lot of added fats into it. So spices are a good way to go as well. And here I'm not sure the folks that are overseas what you're seeing in terms of portions when things are available that way, but we way overserve. So our portions here are way too big. And so if you're somebody who leans on takeout significantly, say it's 3-4 meals a week that you've got takeout for that dinner meal, you're going to be at a higher risk for too many calories coming in if you're consuming
Mhm.
all that food. So it's really important. Weight management is significant with regard to inflammation in the body, which is part of your immune system. And so I think it's important to make sure that portion appropriateness is exercised